Hello everybody, Dr. K.K. Agarwal, President. Now, before we go to the subject of the day, let's have a ritual of washing our hand. We take the Ultra Protect Gel and we take it and we say S for Seedha, U for Ulta, M for Muthi, A for Angutha, N for Nakhun, and K for Kalai. Once we have done that, we are ready for the topic of the day. What is common between COVID-19 and the cancer? And to discuss with it, I have a special guest, Padma Shri awardee Dr. Ashok K. Ved. He is currently the chairman, medical and hemato-oncology, Medanta Cancer Institute at Medanta, the MedCity in Gurgaon. He was instrumental in establishing the Department of Medical Oncology, Bone Marrow Stem Cell Marrow Transplant Unit at Rajiv Gandhi Cancer Institute. Numerous publications to his credit, contributed to books, chapters, and whatnot. Completed more than 60 national and international studies across all phases of clinical research from phase 1 to phase 4. He is a PG teacher with National Board of Examination and has been training medical oncologists for the last 15 years. Welcome to our show, the 163rd non-stop show on COVID-19.
Namaskar. Thank you, sir. Thank you, sir. Namaskar. And it's a great honor and a pride to be a part of the proceedings this evening. And I thank you for this opportunity given to me. Thank you, sir, once again.
So I'd like you to have some slides giving some orientation about the cancer situation, and then we will have discussion on similarities and dissimilarities between COVID-19 and the cancer pathophysiology.
So what I will do in the next 5 to 7 minutes is take you through the scenario about cancer in India. And the figures are, I'm sure, going to surprise many of us because it's become a common disease. And can you see my slides? So I will take you through very quickly through the cancer scenario in India and show you the common causes and what it takes to suspect or detect cancer early enough. Now, if you take the overall scenario, the number of cases which happen globally and in India, actually cancer surpasses tuberculosis, AIDS, malaria, all three of them put together. Now, why we say that cancer has been an uncommon disease? Because this is a scenario which is being carried over from the 70s, 80s, and the 90s. Because if you look at this slide, in the 70s, only 15% of the cancer cases came from the developing world. But what is disturbing is that by 2030, there would be about 70% of them. And India being such a populous country, one can imagine the number of cases which would happen within this nation. And this slide tells us about the dismal numbers. And I draw your attention to the bottom part of this slide that almost about 17 lakh new cancer cases will be diagnosed each year. And if you put those together with them, those who are surviving cancer, the number is more than 30 lakhs. This is in the backdrop of the fact that cancer is not a notifiable disease, and every cancer case which is diagnosed in this country doesn't go into a registry. So the numbers are actually going to be higher than what is projected here. This is the geography and the cancer map of India. The darker the blue, more the cases and more the incidence of cancer in India. And one can see that a lot of these states have been covered in the high incidence cancer states. The highest incidence is in Aizawl district, and this is almost about 207 per 100,000, which is equivalent to one of the highest in the US incidence rate, both amongst men and women. One can see that the cases are very much out there in the Aizawl district. And let's talk about Delhi NCR. One can see that the commonest cancer amongst men is lung, followed by mouth, prostate, tongue, and amongst women is breast and uterine cervix, followed by gallbladder. There is a very curious sort of a cancer which happens dominantly in North India. Gallbladder is less often seen in the southern part of India. We don't know the reason to that. This is a question we are asked many times in the clinic, that what are the factors which contribute to causation of cancer? And look at this slide, smoking or the use of tobacco is about 30 to 40%, which goes to say that if we ban tobacco today, about 30 to 40%, one third of the cases of cancer would go away over the next about 20, 30 years. But then this is a very complex issue because it needs a whole lot of action. And this is a new alert given by WHO that obesity contributes up to about 20%. So 50% of the cancer cases happen either because of tobacco or because of obesity, and other causes like viruses, family history, occupational exposure, all these contribute, and even the environmental pollution. So amongst men, cancers related to tobacco, one can see that the highest numbers come from many of these cities which have very high incidence of tobacco-related cancers, and amongst women as well. And Meghalaya actually is common to both of them. Again, a question which is asked is, what are the cancers which are more common in tobacco users? And the list is quite long. This is almost about a dozen and a half, about 18, 20 cancers which are common. And the commonest amongst them are lung, food pipe of the mouth cavity, the food pipe, oral cavity, lip, nasopharynx, and some of the uncommon cancers, less common with the smoking, are even leukemias, uterine, cervix, pancreas, and kidneys. I need to talk about the secondhand smoke because the non-smokers be aware, and that is why the government has brought in the legislation about no smoking in offices and restaurants and all that, because second-hand smoke is a mixture of smoke released by any of the use of the tobacco, and it also contributes to many chemicals and is the cause of cancer and many other diseases, respiratory diseases and others which are associated with tobacco, even amongst those who do not smoke but are exposed to secondhand smoke, be at workplace or even at home. So this is one of the very infamous stories of the Marlboro story. The two of the original Marlboro men died of, and you can well imagine, lung cancer. And this is what actually advertising and the pressure of advertisements can play havoc. And that was the reason, sound reason, why to ban all forms of tobacco advertisements. And another shocking part is that tobacco contains 4,000 chemicals, out of which 40 are linked to causing cancers, and there are 500 poisons. So think before one takes up use of tobacco. Though the cancer incidence has been high, is rising, but India is still lower as compared to the international data. This is Brazil and many other Western countries, but India is still out here. Aizol, as I said, is much higher amongst the Indian geographies, but still lower as compared to the Western data. When should anyone in his lifetime suspect? There are certain warning signals, 7 of them: change in bowel or bladder habits, a sore that does not heal, unusual bleeding or discharge, thickening or a lump in the breast, testicles, or elsewhere, indigestion or difficulty in swallowing, which could be the food pipe, or stomach cancers, obvious change in the size, color, shape, or thickness of a skin wart, mole or mouth sore, and nagging cough or hoarseness of voice. These are common symptoms. If they persist beyond about 2 to 3 weeks, 2 weeks, please consult your doctor. It may not be cancer, but it may pick up the cancer early and lead to a better outcome, lesser treatment, and therefore lesser burden on the pocket as well.
So thank you, Ashok ji, for a wonderful update on the country's picture. Before we go further, ये Aizol में ऐसा क्या है मिजोरम में जो इतना cancers हैं? What is the reason?
There are a couple of reasons. One, the use of tobacco, and number 2, if you look at the structure of the houses, all the houses are one unit, and the entire cooking happens within that house itself. And secondly, the use of certain types of meats and the way they cook their meats. I think this is potentially, it's a one can say a mix of the exposure to smoke, tobacco, and the use of certain types of meats and the way these meats are cooked. These are all leading to higher exposure to carcinogens and high cancer incidence.
Coming back to, we said about some of the viruses are linked with cancers.
G.
And what about COVID-19 in future?
So COVID-19 has been a very interesting story, and the earlier literature, in fact, about COVID came from the Wuhan University, then from Italy, and from the rest of the Western world, and our own understanding and our own learning over the last 8 to 10 months. So we don't know today whether this would be the cause for any causation of cancer in future. We don't know structurally whether this is a virus which makes inclusion bodies into normal cells or not, and causes a change in the genome, genetic structure of that cell, and leading to damage to the DNA and leading to cancer causation, because बहुत सारा cancer causation is linked to the basic disruption and damage to the DNA. What does tobacco do, or what do other viruses do? They get into the DNA genome of the normal cell and damage that, and then lead to a cancer causation. So early days.
उसके हिसाब से, क्योंकि ये RNA वायरस है, ये सेल में घुस ही नहीं रहा, DNA में घुस ही नहीं रहा, तो ये कैंसर नहीं करना चाहिए।
हमें शंका यही उम्मीद है कि ये कम होगा।
इसका मतलब है जितने भी वायरसेस कैंसर करते हैं सारे डीएनए वायरसेस हैं।
So most of them, जी, EBV, hepatitis C, जो Epstein-Barr virus, these are the viruses which are human papilloma virus, notorious for the cervical cancer and certain forms of
tissue inflammation of the cells.
G.
That means cannot cause cancer, independent of genome.
So chronic inflammation, yes, which is well described. And the chronic inflammation, किस तरह से? Famous cancer from the region I come from is called as the Kangdi cancer. जो hot pot, जो बिल्कुल बदन के पास रखा जाता है, it leads to a chronic irritation to the skin, and it causes because of that persistent heat and an inflammation in the skin happens, it can cause cancer. पुराने burns जो हैं, those the non-healing ulcers, which are the cause for chronic inflammation, can lead to skin ulcers. We know that chronic inflammation and certain parasitic diseases, which doesn't happen in this part of the world, which is more in the Egyptian, those regions, bilharziasis, जो urinary bladder का irritation करता है, chronic inflammation करता है, वो cancer causation में है. Yes, chronic inflammation.
Ultimately, cellular inflammation.
जी.
Persistent chronic cellular inflammation can convert into a cancer.
In certain situations, yes. The answer is yes, and there is a proven cause-effect relationship between the two.
So what causes cancer now? At a level of a cell, how should a normal cell becomes a cancer cell?
So for the एक normal understanding के लिए, body के अंदर every cell is programmed to live for a certain period of time. For example, the average lifespan of a red blood cell is 120 days, and the body takes away the older cells and replaces them with the newer cells. We get a new lining in the mouth every few weeks. And imagine the entire digestive tract gets a new lining. We get a new lining on the skin almost every 1 month. So कहने का मतलब ये है कि billions of cells are recycled in the body. और ये साइकिल का पूरा जो एक जो अंजाम होता है, वो ये है कि एक normal cell goes through a programmed cell death called as apoptosis. जब ये apoptosis disturb हो जाता है, एक जीन है, P53 जीन है, जो पूरे जीनोम को, पूरे डीएनए को, पूरे सेल के डीएनए को प्रोटेक्ट करती है. यदि इसमें कोई डैमेज आता है तो ये प्रोग्राम सेल डेथ जो है डिसरप्ट हो जाता है. एंड दीज सेल्स कैन कन्वर्ट इनटू कैंसर सेल्स बिकॉज दे स्टॉप ओबेइंग द कमांड्स ऑफ द नॉर्मल birth and death of those cells. So these are rogue cells, those which have stopped obeying the command. But ये command का शुरुआत कहाँ पे है? This has to happen at the damage to the cellular level, at the DNA level, and certain types of inflammations, as we have already touched upon.
So on what P53 gene depends?
सो P53 इस शरीर की रचना में एक प्रोटेक्शन है. इट्स कॉल्ड एज द प्रोटेक्टर ऑफ द जीनोम. तो वो एक कवच है, रक्षा कवच है, इस शरीर में बनाया हुआ है. उसमें कुछ गड़बड़ाहट जब होती है तो बहुत सारा जो कैंसर्स में जो है उसका फिर योगदान रहता है.
अब कोविड के अंदर की इम्यून रिएक्शन में और कैंसर की इम्यून रिएक्शन में क्या फर्क है?
दैट्स अ वेरी पर्टिनेंट क्वेश्चन सर. कोविड जो है इम्यून सेल्स, एक इम्यून रिस्पांस ओवर रिस्पांस करता है. बॉडी रिएक्ट करती है कोविड वायरस को और ओवरशूट करती है. कहने का मतलब यह है कि एक तरह का जिसको हम इम्यून स्टॉर्म है, एक तूफान सा खड़ा हो जाता है बॉडी के अंदर और वो एक ओवर हो जाता है, ज्यादा हो जाता है एंड ऑर्गन्स के अंदर इन्फ्लेमेशन आ जाती है. कैंसर के अंदर जो है एक्चुअली कैंसर itself is an immune suppressive state. Why cancer grows and spreads unchecked? Because cancer cells are smart cells. ये कुछ ऐसे तत्व, ऐसे प्रोटीन्स, ऐसे कोई केमिकल्स सिक्रीट करते हैं जिससे बॉडी के अंदर इम्यून सिस्टम को ये बाईपास कर जाते हैं और इम्यून सिस्टम को लिटरली पैरालाइज कर देते हैं. दे पुट द इम्यून सिस्टम टू स्लीप. इट इज लाइक द गार्ड स्टैंडिंग आउटसाइड your home, they go to sleep and the invaders can come in, or guards on the border, they go to sleep, there is some phenomena and the invaders can come in, or they can roam about unchecked. तो कैंसर सेल्स जो हैं अनचेक्ड क्यों जाते हैं? बिकॉज वो बॉडी की इम्यूनिटी को दे पुट इट टू अ स्लीप स्टेट.
So what are these proteins or whatever you call them as?
So
immune sleepers.
सर ये प्रोटीन्स जो हैं इम्यून प्रोटीन्स हैं. These are a very complex एक पूरा एक सिस्टम है, बॉडी का इम्यून रिस्पांस का सिस्टम है जिसमें PD-L1, CTLA4 ये कुछ एक प्रोटीन्स हैं. इनफैक्ट PD-L1 is called as a programmed death ligand. मतलब हर सेल की प्रोग्राम डेथ है. वो प्रोग्राम डेथ नहीं हो रही है बिकॉज ये प्रोटीन्स जो हैं ये इन्वॉल्व हैं उसके अंदर. या दूसरा क्या है कि कुछ जो सेल्स हैं बॉडी के, जैसे डेंड्रिटिक सेल्स हैं, which are the cells which actually pick up the fragments of infection, virus, cancer and pass it on to the cells of the immune system. उसको वो जाके बताते हैं कि दोस्त मेरे ये देखो तुम्हारा दुश्मन ये है. They present it to the cells which are called as the T cells. These are the immune cells, defense cells of the body. और टी सेल जाके वो इन्फेक्शन को, कोई भी फॉरेन मटेरियल है, बी इट वायरस, बैक्टीरिया, ट्यूमर, उसको जाके क्लियर आउट करता है. बट कैंसर में टी सेल हैज गॉन टू स्लीप एंड देयरफॉर द इम्यून सर्वेलेंस जो है बॉडी की वो पैरालाइज हो चुकी है एंड देयरफॉर कैंसर ग्रोज एंड स्प्रेड्स अनचेक्ड.
तो क्यों ना ऐसी सेल्स को, प्रोटीएस को इनहिबिट कर दिया जाए?
Sir, that's a very valid science and a science of the last about now 15-20 years. ये surprisingly साइंस को खुद अपने आप में ये 15-20 साल में पता लगा कि ये मैकेनिज्म है. इसके लिए नोबेल प्राइज मिला है और विद इन द लास्ट अबाउट 5 to 10 years बहुत सारी बायोलॉजिकल ड्रग्स हैं जिनको मोनोक्लोनल एंटीबॉडीज बोलते हैं. दे हैव बीन अप्रूव्ड, रेज्ड and they are commercially available. बहुत सारी कंपनीज ने मार्केट करी हैं and some of them have been very highly successful in treating even late stage cancers, stage 4 cancers. तो ये drugs sir, yes, this is a very sound science and based on very fundamental principles on which drugs have been developed and they are already commercially available, sir. These are called as immune checkpoint inhibitors.
So, अगर हम आज की डेट में देखें जो mRNA टेक्निक आई है जी, डू यू थिंक mRNA टेक्निक से ये कैंसर की सारी थेरेपीज चीपर हो जाएंगी, जल्दी बन जाएंगी?
सर उसमें बिकॉज mRNA is only one part of the repertoire या उसके अंदर का जो सेल की इंफॉर्मेशन है. mRNA holds only a certain part of that. There are many antigens जो कैंसर सेल के या ट्यूमर सेल के सरफेस के ऊपर है, या देर आर सिग्नलिंग पाथवेज हैं जो सरफेस से स्टार्ट होता है. वो माइक्रो एंटीना है जो एक प्रोटीन को पकड़ता है, अंदर को सिग्नल भेजता है, वो न्यूक्लियस के अंदर सिग्नल जाता है, and that nucleus then reacts, produces the type of the genetic material which is required or the truncated जो गलत genetic material है जो कैंसर सेल को बढ़ावा देता है. तो yes, it may be part of it, and mRNA or the RNA technology is being used in cancer for that is called as the electroporation by small shock waves, the micro shock waves. We get the genetic material into these cells of the immune system and teach them how the RNA looks like, and then these cells go and pass it on to those T cells and to fight the cancer cells. तो ये science बहुत robust है, दो complex है, and is a science which is very fast evolving and very futuristic as well.
आज के डेट में if money is not an issue,
जी,
कौन से ऐसे कैंसर्स हैं जो हम विजय पा सकते हैं आज के डेट में if money is not an issue?
So traditionally, sir, sorry for that interruption. Sorry, maybe in that excitement, because science has in the last about 15-20 years, so much has happened that targeting of tumors has become a very, very sound science, and we understand how to target these tumors. और वो targets define हुए हैं, और ये targets define होने के बाद जो है drugs raise करी जा रही हैं against single targets. For example, lung cancer 20 years back, probably when we were students of pathology, we were taught only small cell and non-small cell, दो तरह के lung cancer थे. Today, lung cancer has become a group of diseases, and there are about a dozen lung cancers for which subtypes of lung cancers for which targeted drugs are available. And these drugs, these targets are available only maybe 1% of the total population of lung cancer, or only 5%. And there are very robust drugs which are available. So the science has moved. So किन पे विजय पा सकते हैं? Pediatric cancers के अंदर leukemias, lymphomas में बहुत high cure rate हैं. Adult tumors के अंदर जो हैं, talking about the biological agents जिनके ऊपर इस समय हम चर्चा कर रहे हैं, the immune checkpoint inhibitors इतने successful malignant melanoma जो dominantly white skin का कैंसर है, इतना सक्षम सिद्ध हुआ कि क्लिनिकल ट्रायल्स के अंदर इवन स्टेज 4 के कैंसर्स जिनको ये कहा गया था कि देयर नॉट मच इज पॉसिबल फॉर देम, दे हैव कम बैक टू नॉर्मल लाइफ विद अ क्योर ऑफ दीज कैंसर्स, एंड मेनी ऑफ देम आर एडवांसिंग इन आवर एप्लीकेशन along with some types of chemotherapies in curing these cancers. Even today, leukemias, lymphomas, yes. Testicular cancers, yes. Bone tumors, yes. And we are headed towards breast cancer, very high cure rates. But most of the organ specific cancers, जैसे मैंने लास्ट में कारण बताए और कुछ लिस्ट बताई है, early detection actually is something very, very important, जिसके ऊपर मैं इस समय टच अपॉन करना चाहूंगा. Early detection and some of the vaccinations, especially for the human papilloma virus, uterine cervix के लिए human HPV vaccination available है. It is a part of the vaccination scheme across the globe, many countries. So Vijay Pana जो है, the beginning has been made in many of these cancers where these drugs are now being used for advanced cancers, but very soon they are moving up into the early stage cancers, and the day is not far that these cancers will be cured. Mantra क्या हो रहा है, sir? You are a cardiologist. You have seen the whole evolution of cardiology. Similarly, what we are seeing is we are trying to convert cancer into a chronic disease. Targets ढूंढिए, उस target के against drug raise करिए, और एक गोली 2 गोली रोज की patient खा के अपने काम पे जाए and convert it into a cancer, into a chronic disease, where the survival used to be 6 to 9 months in standard for lung cancer, stage 4, 20 years back. The survival has been extended to 3 years and plus. And in some of these cases, the patients are living on these pills for 5 years and beyond. So science is moving, our understanding is getting better, and the applications are getting better.
I want to specifically come back to 2 examples जो public जानना चाहेगी अभी.
Sir.
One is the case of our star युवराज, उसका कैंसर क्योर हुआ.
जी.
So was it surgery? Was it something else?
So जैसे मैंने touch upon किया कि testicular tumors, these are called as germ cell tumors. He had a type of germ cell tumor which is exquisitely sensitive to chemotherapy, and majority of these patients, even in stage 4, they would get cured. The famous example of Lance Armstrong, that the famous cyclist, and he had even spread of his cancer to the brain. He was a testicular cancer. He was cured. He even underwent a brain surgery, but he was eventually cured of his cancer. So these are germ cell tumors where there is a very high success with
And what
medications.
about संजय दत्त के बारे में कह रहे हैं कि क्योर हो गया, लंग कैंसर था?
Sir, honestly, the information is not much in the public domain. But as I said, lung cancer is not one disease today, and there is a very high success rate, even in very rare types of lung cancers, which carry certain mutations, yeah, genetic aberrations, for which drugs are available, only pills are available, or these immune checkpoint inhibitor drugs are available. So there is a fairly good amount of success with lung cancers as well.
How common is neuroendocrine tumors? जो इरफान को ले गया.
So बहुत interesting question है sir ये. Neuroendocrine tumors constitute 1% of the total cancers, and the incidence is rising at the rate of about a fraction of a percent, up to it's being said that maybe about 1% per year. And इसके अंदर जो suspicion है, दो बातें हैं. Number one, earlier days diagnosis of neuroendocrine tumor was not very prevalent, क्योंकि कुछ markers की application, understanding of these tumors नहीं था हमारा, and special stains जो available नहीं था. Science has again learned all that. Number two, it is suspected that the rampant use of प्रोटॉन पंप इनहिबिटर्स, जो एसिडिटी के लिए हम जाके कॉर्नर के केमिस्ट से खुद खरीद लेते हैं, हफ्तों खाते हैं, भले डॉक्टर हफ्ते के लिए 2 हफ्ते के लिए लिखता है और उसको हम फिर कई महीनों बरसों खाते रहते हैं. सो यूज ऑफ रैम्पेंट यूज ऑफ द प्रोटॉन पंप इनहिबिटर्स इज वन ऑफ द इंक्रिमिनेटिंग फैक्टर्स. इस शरीर की रचना बड़े साइंटिफिक रीजन पे हुई है. अगर स्टमक के अंदर एसिडिटी बनाई गई है तो किसी पर्पस से बनाई गई है. यदि मैं उसको ये पीपीआईज खा के उसको हफ्तों महीनों बरसों उसको सप्रेस करता हूं, तो एक एबनॉर्मल सिचुएशन मैं क्रिएट कर रहा हूं, जिसको नहीं करना चाहिए. आई थिंक दिस इज एंड न्यूरोएंडोक्राइन ट्यूमर्स आर एक्चुअली one of the now common tumors, and depending upon the type of the facility where you are working. I work in a very, very strong gastrointestinal with a very strong gastrointestinal surgery and a medicine unit, and we diagnose a lot of the NETs at our center, and we are treating a lot of them.
I want to come back to one campaign. I'm looking for a common marker to prevent all diseases.
Sir,
means I'm talking about obesity, जहाँ पे fat cell is the foreign body.
Sir.
Then atherosclerosis, जहाँ पे LDL घुसा. Smoking, जहाँ पे again pollution carcinogen घुसा. Pollution के अंदर में particulate matter घुसा. Allergy में pollen घुसा. Bacteria घुसा. Viruses घुसे. So cell के अंदर में it's a fight between self and non-self.
जी.
It's a fight between self and non-self, and
True.
Self wants to get rid of the non-self.
True.
So in the initial phase, before a cancer develops, before your PDL1 and other things gets activated, there has
True.
to be a cellular inflammation.
True.
And the marker of cellular inflammation in cardiology is CRP less than 1.
Ji.
C-reactive protein less than 1. That's a marker in cardiology. We say if the CRP is less than 1, then you are not going to have a atherosclerosis. So that's a marker of inflammation, and CRP is produced by IL-6, and IL-6 and TNF-alpha ultimately are the first response of inflammation whenever there is an antigen presenting cell coming. So the first presentation will be locally TNF-alpha. And secondarily, there will be a formation of IL-6, which will cause rise in CRP.
Excellent. I think congratulations for that.
You feel that will make a difference, because if now when you say CRP is high, you look for what is the foreign body. It may be fat, it may be LDL, it may be smoking, it may be pollution, it may be anything. Look for it, and then try to find out. Your aim should be to bring it CRP to less than 1, so that the initial movement of inflammation is not there before your PDL1 starts sleeping.
So very interesting, sir. I think there is going to be a lot of collateral benefit, because there is a lot of commonality between the cardiac and the cancer diseases. Because what you do good to prevent cancer also works for cardiac diseases and vice versa. Low fat diet, obesity, अपना वजन को संतुलित रखिए, एक्सरसाइज करिए, टोबैको मत यूज करिए, 50-60% तो ये बीमारियां ठीक इसी से ठीक हो जाएंगी, प्रिवेंट हो जाएंगी. But I think, I have to take you a little back in history. There was a only health survey done by the Britishers during that time was in the early 30s. I think it was 1931. And interestingly, cancer was not one of the diagnoses in the top 10 diseases. उस समय तो smallpox, malaria, यही सब infectious diseases थी. तो 1931 और 2021 के बीच में. So what has happened in the last 80-90 years? I think what has happened is our lifestyles have changed. We have killed our environment, and we have changed ourselves, and we have moved away from nature, and we have destroyed nature as much as we could. So the answer is actually all in history. Though cancer has been there, if you see those paintings from the 2000 years back, उसमें भी दिखाया है breast cancer के cases हैं. Why? Because certain things we cannot change. We cannot change the ionizing radiation which is bombarding us, which is coming from the cosmic rays, which is coming from the ground, terrestrial this thing, and which is causing the low scale DNA damage. DNA damage is a way of life. Body has an inherent mechanism to repair that DNA, but we are compounding it by all that bad which is happening in our environment, in our diets, in our lifestyles, and so on and so forth. So this will be a great initiative with direct as well as collateral benefit, and I see a great value to it.
Thank you. मेरा इसका रीजन ये था इस कैंपेन को लाने का, क्योंकि हम ऐसे कार्डियोलॉजिस्ट बोलते हैं कि अगर आपकी भट्टी गर्म नहीं है तो जितना मर्जी LDL घूम रहा है वो चिपकेगा नहीं. So unless there is an inflammation, high LDL is not going to stick. So if you can stop that inflammation, even high LDL will do. Similarly, if you stop the inflammation, even if there are radiations, असर आने में टाइम लगेगा.
जी. And tissue damage नहीं होगा. Absolutely.
So thank you, Ashok ji, to be here with us. It was wonderful discussion, and I think all my viewers, you should have seen that how simple presentation has been of Dr. Vaid, who has clearly differentiated between inflammation and cancer. And today one thing is clear, that our campaign now, because we are discussing every day to bring this campaign to bring your CRP to less than 1. That's all for today. Let me say thank you to Ashok Vaid ji to be here with us.